Hello YouTube fam, or should I say Live Hope fam. You might think that's cheesy, but I think it's cute. So before we get started, if you haven't already, subscribe to my YouTube channel so you can follow me along on my journey and get updates every Wednesday and Friday. Of course, you can wait till the end of the video, make sure you like the content, but you know, just letting you know. Today we're going to be talking about the 11 criteria for lupus. This 11 criteria is used by rheumatologists to diagnose lupus. I just want to clarify, I'm not a doctor. Most of the resources for this video come from the Lupus Foundation of America, which, as many of you know, is one of the biggest foundations for lupus. Previously, I did do a video on lupus tests and diagnoses. So if you haven't already, go ahead and check that out. I will link it onto this video and in the description below. So first we're going to talk about the malar rash. So the malar rash, or the butterfly rash it is also called, can be found along the face right here. So it's basically going to bridge over your nose and go across, and it makes kind of like a butterfly. That's why we call it that. I have discussed this on my Instagram as well. How many of you all get the malar rash? Because I get it, but very lightly on my face. You can hardly tell that it's going on, but that's usually an indicator of I need to slow down. The second criteria is going to be the discoid rash. So this is a different type of rash that can be found all throughout the body and even on your scalp. And discoid lupus is a different type of lupus, but it is an indicator, and sometimes even if you have SLE, you'll get these as well. This rash usually appears red, raised, and disc-shaped. They're almost like patches. If you have discoid type rashes, go ahead and let me know in the comments below and let everyone else know how that feels and how it affects you. So the third one is going to be photosensitivity, and this is basically just having the sun affect you, whether it be making your joints flare, making you more fatigued, just can't stand to be in the sun, or even a rash forming after the sun. This is something that I have, and most lupus patients should not go into the sun. Fourth criteria is going to be oral ulcers. So those little annoying ulcers that you get inside of your mouth or inside of your cheeks, sometimes they can even be on your tongue. So you want to look out for those. This is something I used to get more so in the beginning, and at times they will prescribe folic acid for that. So if you do have ulcers, I would talk to your doctor and see what's best for you. The fifth criteria is arthritis or joint pain. So this is going to be swelling in one or two joints for lupus. I'm pretty sure most of us with lupus have it in more than just one or two joints. But if you notice, when you get arthritis pain, it's usually, at least for me, it's usually on one side, or it'll be on just these couple fingers more so. Even though they're all tight, one will be more inflamed than the other. And lupus is not damaging to the joints, and that's one of the differences between rheumatoid and lupus. The sixth criteria is going to be serositis. So this can be seen in many lupus patients with pleurisy or even pericarditis. With pleurisy, that's basically the lining of your lungs is swelling, and it causes that pain within your lungs or your chest, even your back sometimes. With pericarditis, it's usually the lining around the heart. Number 7 is going to be kidney involvement of any kind. So if you take the urine test and they see protein in your urine, that can be an indicator, and they'll be able to check off one of those criteria. Number 8 is going to be any neurological disorders such as seizures or even psychosis, because lupus can affect anything, even your brain. Number 9 is going to be blood disorder. So any type of low platelet count, low red blood cells, which is going to be anemia, low white blood cells, those I can't talk. Those are all indicators that you could have lupus as well. So number 10 is going to be involving blood work. So if you have anti-DNA, anti-SM, or positive anti-phospholipids, those are going to be indicators of lupus as well. So number 11 is the big one. If you have abnormal ANA or antinuclear antibodies, that is a huge indicator of lupus, and usually they won't fully diagnose until you have that ANA and it is positive. And this is why it takes so dang long for so many of you to get diagnosed. So in the comments below, I'd also like to hear how long it took you to get diagnosed with lupus. I was very lucky that at the time, I believe I had it longer than a year before I went to the doctor for it. But at the time I was so swollen and my ANA was just soaring. So there was no question I had lupus. If you have any of these criteria or up to 4, I would definitely go to your primary care physician, request to see a rheumatologist because they're going to be able to help you most. One thing I do want to say is that if you are going to the doctor, if you're in pain and you know something is going on, make sure you're advocating for yourself. Even if you don't have lupus and it's something else, just continue to advocate. Don't give up on yourself because you know you're feeling those things. The biggest thing I want to say is that sometimes your doctors or your team is not going to be on your side. And if you know in your heart that you're feeling these things and you feel like you should be getting better care, go and get that better care and take care of yourself. Do what is best for yourself. Don't always believe what they're saying. And of course, the doctors are going to be right most of the time, and they know, they see so many different patients, but they shouldn't discredit you for the pain that you are in. And that is why it is important that you advocate for yourself all the time and just make sure you're being heard. I want them to believe you because I believe you. All right. After that, I guess this is it for this video. And again, I am posting every Wednesday and Friday at 2 p.m. Pacific time, so I hope to see you around that time. Trying to do a whole variety of videos. Of course, I'm going to stick to lupus videos, but I'm also going to be bringing in other diseases as well now after my autoimmune disease video. And I'm excited. I hope you guys are too. Don't forget to subscribe, like the video, and get notified. I'll see you next time. Bye.